everyone. Welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. It's wonderful to have you here. And if you're new to us, welcome. We're bringing you some really exciting conversations with leaders that are painstakingly shaping the future of healthcare. We're really passionate around leadership, access, healthcare innovation, and adoption. And if it's your first time tuning in, let me just sort of take a quick step back and tell you what we're trying to accomplish and do here. So our focus is bringing real stories of those that are truly innovating within our space. Not just talking about it, rather actually in the trenches, doing good stuff. And we want to open up this space to be able to give them the ability to share their story with our community and ultimately with the world. And if you haven't checked out any of the historical episodes, make sure that you hit the subscribe button now to check out any new and future episodes. We've got an amazing action-packed year, which is some incredible guests, and I'm just super excited. And as you know, our field is constantly evolving and there are new things that are coming up. And it's crucial to have leaders that really are envisioning the future. They're embracing innovation and addressing many of these pressing challenges. And our guest today is one of these leaders that's making stuff happen. We're incredibly fortunate to host an innovator, Joe Rafferty. Joe's pushed the boundaries and spearheaded innovations throughout his career. His journey has been marked by several, I'll call them tours of duty, leadership roles where he's successfully integrated strategic foresight with operational excellence, spanning several highly respected, positions in academic medical centers, community hospitals, and physician groups. And many of these roles include stints in Pennsylvania, Texas, including Tenet Healthcare, Nexus Health Systems, and Memorial Hermann Healthcare System. Currently, Joe is applying his vast experience at Sellers Dorsey, focusing in on Medicaid financing and Medicaid risk strategy. And we'll dig into that a bit more today. Joe's going to basically share, hopefully, a lot of his insights from his vast experiences discussing his approach to healthcare innovation and the strategies that he employed and deployed in designing durable healthcare systems that aren't necessarily prepared to face the challenges yet thriving throughout those types of environments. So Joe, it's great to see you, man. Welcome to the show.
Hey, thanks for having me. It's good to see you, Michael.
Yeah. So let's give the audience, I didn't do it justice. I probably could have done it better, but I know we're limited on time. Would you mind maybe just sort of sharing with our community just a little bit about your story and sort of your journey? Give us a little bit more of an in-depth flavor about that, and then we'll dig in.
So I started in healthcare in California, working with Tenet Healthcare, which is one of the largest for-profits, or was one of the largest for-profits in the acute care hospital sector. Really got some really great training in finance, and moved my way up into business development, and operational roles. Moved over to Texas, worked at Memorial Hermann. Once again, did a lot of strategic planning, finance work, and developing new service lines and new markets. Did the same thing with Tenet in Texas as well. And that's when I actually became an opportunity to become a CEO. Was when I was in Texas, and that was an incredible experience to start doing that at a fairly young age. And then continued in the CEO role in Southeast Pennsylvania, just outside Philadelphia, in the Delaware County market, and got the opportunity to run a hospital, also run a system, hospital-based EMS company at the same time. And so really got to see, not just what happens within this the four walls, or the safety of four walls, and having all the resources available to clinicians and administrative folks, but also to see what happens in the families' homes, what happens out in the communities that none of us really, we don't typically see it, or do we want to see it? Because a lot of times, what happens in the hospital is kind of a reflection of what real life is for most people. And I'm very fortunate to live a great life, great family, and great friends. and live in a nice area, and then not everyone else gets to enjoy that. So I really am very grateful, and I got to see that for over 21 years in hospitals, how most of the world actually lives. So um,
Thanks for sharing that. So now that you've done a few different tours of duty, and as you've seen those challenges, sitting in the seat and embracing those challenges, did you find that some of those challenges varied, whether you were in an academic medical center setting or a community hospital? Did you find or a common theme that you saw within those spaces?
I think the common theme that I've really been thinking about over the past few years now that I've been out of the health systems is that we're not really meeting patients where they are, and we're still really focused on care in the emergency departments, and we're not a proactive industry. And if we became more proactive and we were meeting patients and families where they are, um, via new technology, um, via other care programs or care management systems, we could really keep these patients in their homes and out of the health systems, um, to where they can give the most acute and most appropriate care in the hospitals, instead of just moving these patients from an ED setting into an inpatient bed, and then next thing you know, you've got people who are boarded in these hospitals and are kind of living in the hospitals for 60, 90, 6 months, and are unable to be discharged. And it's just not a very good use of resources. So if we were able to utilize resources more efficiently for the entire health system, it would benefit not only our bottom line from a hospital perspective, but also it really benefit the lives of the patients and the families that we serve.
Mm. So someone shared a stat with me the other day that 50% of the babies born in this country are born under Medicaid. When you talk about Medicaid financing and Medicaid, risk strategy, unpack that a little bit for us.
Well, really they're two different things, but they're one and the same. So Medicaid financing is really about working within states that fundamentally have taken on managed care from a Medicaid perspective. So those that have taken on managed care, and they're now, we look at strategies as to how can we help with those facilities that see a lot of Medicaid patients or a lot of the underserved, and ensure that they actually get paid up to a reasonable rate, or what they call the ACR, the average commercial rate. We try and do that to ensure that these safety net hospitals can keep their doors open, continue to serve the communities that they're in, and ensure that there's quality and equitable care and access to care for all populations, not just folks that have a Blues plan or an Aetna plan, et cetera. So so that's Medicaid financing. So that working in Medicaid financing, it's really about directed payments, et cetera, within states that have uh, managed care from a Medicaid perspective. The Medicaid risk strategy is really focused on those health systems that, maybe they have their own Medicare plan. Maybe they see a significant amount of, maybe they're not a safety net hospital, but they see a significant amount of Medicaid patient, a significant population of the Medicaid population in their community, and maybe they want to look at how do we continue to see and serve these patients in this population, but also, they still have a fiscal responsibility to keep their doors open.
Right.
So
Yeah.
how do you look at where you are serving this population, and if they're looking at, hey, how do we take on some risk? How do we look at how are we, do we have the right people? Do we have the right processes? Do we have the right technology in place to, coordinate care of this population, to understand the underlying issues within this population, like, is there, uh, uh, diabetes care? I mean, there's all this risk stratification that happens within the industry, but can you do it effectively and then actually take that out into the community to ensure that they're getting the right care at the right place? And so most of these issues, if we're coordinating the care appropriately and we have the right tech stack in place, you can move that care outside of the hospital where these hospitals, instead of taking on this patient population where they're getting paid 40 cents on the dollar,
Right.
from a cost perspective, they can actually effectively take care of this patient. They can live a healthier life in a different space and also keep the hospital and system um, financially viable.
Are there examples that you can draw upon of organizations that are deploying and doing this remarkably well, that kind of can make it sort of a template that someone else can repeat? Or is this a state by state, situation by situation, very unique in and of itself?
So what I'm finding is that it is absolutely well, it is state by state because Medicaid's state by state, right? It's different by state.
Right.
From an organizational perspective and looking at Medicaid, taking on risk in Medicaid or just having a Medicaid strategy, that's different by organization because every organization has, let's say a different number of hospitals, a different service lines that they have, or a different number of employed physicians or not employed physicians. So their infrastructure is different by organization that's out there, and then by state. So you really just have to approach the system and ask them, okay, where are you? You go through kind of a discovery, session. Where are you right now, and where do you see yourself? And then we build a glide path for them to move toward. Hey, look, in 2028, we want to have a Medicaid plan, our own Medicaid plan. Okay, great. Well, we have to do an assessment of, okay, where are they right now, risk assessment, and then build them from that. You build a glide path. That's how do you get there without um, without without losing a ton of money and continue to stay financially viable for that community.
Yeah, I mean, this plane is. I'm thinking about that. This plane is mid-flight. You're not going to just say, "Hey, we're swapping out the engines mid-flight," and expecting that everything's going to be just dandy.
Correct.
What I'm marveling at here is that you're looking at Medicaid opportunistically, whereas others view it as a depletion. And I'm trying to put that together.
Yeah, it's absolutely it's kind of backwards. And so growing up in mainly working in for-profit health systems, and even when I was working in nonprofit or academic systems, no one was ever taught from an administrative perspective, how do you handle or deal with the Medicaid population, right? How do you, well, you deal with them through the emergency department, right? Everyone gets the same care. People are treated, they want everyone to be treated the same. But at the end of the day, you still have to be financially viable. You're still running a business. And so typically what we kind of ignored the population and tried to gain as much market share from a commercial perspective to make up for whatever came in from a Medicaid perspective. But at Sellers Dorsey, with what we're doing, it is absolutely looking at it from a different lens and saying, look, this is a population that is growing. It's the largest payer in the country, and it's growing. It's going to continue to grow. How, outside of having a single payer system, how do we ensure that these folks get the right care, right? And they have access to care. And how do we then support the providers of the care, the people on the front lines, the doctors, the nurses, and the health systems, or just physician groups, because there's various types of direct to payment programs, how do we support them to continue their mission of taking care of the community in their patients? So we look at it from, okay, from a pure financial perspective, and policy perspective. How do we meet the state's goals, right, in serving the population? How do we help the health systems meet their goals? And then, we put together a policy rationale. We work through the state, we work through CMS, and side by side with the system to ensure that they're able to serve the community. Because ultimately, that's what I love about hospitals and health systems. It's all about helping the community, and we're very fortunate to be able to support health systems and support physician groups to continue the mission, because they're doing great work.
Incredible. You mentioned technology a couple different times. Where does that play a role within this entire sort of thesis?
Well, at the end of the day, those that so when you look at Medicaid risk or any type of risk that any of these systems are taking on, it doesn't have to be specifically Medicaid. It could be any type of risk, a financial risk that you're taking. Unless you have real-time data, unless you have systems speaking to each other and you're looking at this real time, you're going to be behind the curve. My experience working with the system, we had a large IPA. We had about, I wouldn't say it was large. It was large in terms of the number of physicians. But I would say that the covered lives was about 100,000 covered lives. So medium size, maybe at best. The issue that we always ran into was at the end of the month, or it could be longer, it could be a 90-day lag. You're finding out how you performed. So let's say it's April, second week April. You're finding out how you performed in January, February, March, in April. So it's backwards, right? It's not proactive. And so when you're finding out in April, heck, we just underperformed. Well, that's a quarter that's gone of the year, and the operation is still going, right? So that the first half of April that you are behind already, because if you didn't perform the first 3 months, you're already down in April. So now you're trying to make up and figure out where you can make changes to ensure that you hit your number at the end of the year. But everything it's retroactive. So
how hard of a lift is that, though, to get real-time data? I mean, is that a huge thing? And now that you're seeing big players that are coming into the space, the Palantirs of the world, is that more doable now, more than it ever has been?
I think it's more I think it's absolutely doable now. I think there are more players. I think there are a few very good players that are out there. But there's a fairly sizable investment that you have to make, and that's kind of the struggle, right? It's like working in hospitals and health systems, and some that I worked in one was a safety net. It's you're month to month at best. So you really have to have a board. You really have to have a leadership team that is thinking longer term than that month to month, right? You have to have a longer vision, minimum 3 years to 5 years because it's an investment. You got to invest in the technology, in the systems, and then you got to integrate them, right? So I'm not saying this has to be a 5-year deal. What I mean is that it's a process to do an assessment of your system, and then you're looking at a 5-month process, a 4 to 5 month process, just to do a basic assessment. If you have a large system, so there's just a lot of investment there in time, and you have to have the right board and the right leadership team that believes in that's supportive of a mission like this.
Yeah, it just seems as though there has to be a lot of alignment to get stuff done. You having sat in the seat, Talk about that. What was it like to, from an energy exertion standpoint, to have to align things and get people to buy in? What was that like?
Well, I think well, what I would tell you is that I don't think I did a great job of that at times. I think that there were um I would say that I could have done better at aligning pieces. You know, when you're fighting the fire, it's kind of like a firefighter, like when they're going in and they're fighting a fire every day, right? The actual fire. And then you're asking them to step back and say, you know, have a 30,000-foot view, but they're in the fire and the
Yeah.
ceiling's falling in on them, and they're just, you know, it's a little bit, it, you know, there's only so much time in the day, and there's only so many dollars that you can um that you have at your disposal. So I really look at some of these systems, not all. I mean, there are certain systems, the ones that I worked at, that we were, you know, we were putting fires out. So there wasn't really a lot of time to, even if you had vision, we didn't have the cash flow to invest in the future or innovation. And so that was an issue. And so that's where, when you look at Medicaid financing and different things, if you can work through some of these issues and align with the state and align with some of these plans to take on risk, you can, you know, have a healthier bottom line that then you can reinvest in your system and in your community.
What type of lift are we talking about here if they get it right? If they get this strategy or and line it up right, what are we talking about here? What kind of outcomes you to the degree
Well,
that you can share?
it depends. So if you're looking at so every system would be different, the size, et cetera. Um, but if you're talking about Medicaid financing, um, you're talking millions of dollars in annual dollars that you could potentially gain. Um, from Medicaid risk, that just would depend on, you know, the population that they're serving and the size, et cetera. That would just be dependent on the system. I couldn't really give you a number on that.
Mm, mm. It sounds like what you're talking about here is that there is a force that is out there that is happening and it's constant. And this strategy in essence is like you're a sailboat. You're positioning the boat to catch this wind. It's happening. So you're either going to go with it,
Yep.
and that's what's going to help kind of speed up velocity. But that velocity, i.e., the additional income revenue that you can generate, can then be deployed in other areas. You can take other strategic bets. But if you don't have that mainstay going,
That's
it's
right.
really, really difficult to make these other bets because those pie in the sky bets could materialize into nothing. Whereas what you're saying is, look, if you're going to exert energy, take the population that you're already dealing with, maximize it,
Yeah.
still deliver the care that you're going to be delivering,
Yeah. And
and
and you have to,
and get paid on it.
and yeah, you're right. And you have to have alignment, like you said, you have to have alignment throughout the entire value chain. So you have to have the doctors that are aligned, right? You have to, and not only your board, et cetera, administratively, that's one thing, but you have to have the physicians aligned with you as well. And when you have that, that's very powerful. Um, but it's bigger than just running the hospitals. Or like, you really have to be, it's an art. You have to be more savvy in terms of how are you dealing within your local community and the local politics? How are you dealing, you know, at the state level, right? Not so much at the Fed, but like when you're running a system, like how are you dealing with the local politics and then the state politics, right? Because unless you're aligned with their goals and you're not serving them, serving the state leaders, you know, you're not going to get the support you need when you need it. So there's a lot of work that's done outside of the hospital from a political perspective that's needed. And this isn't about glad handing, and it's that people have a kind of I remember one CEO, I worked a lot in the community. He always asked me like, well, why do you do that? Why aren't you just in the hospital? And I'm like, well, because our hospital is just one piece of the equation. We're kind of the, you know, we're the convenience store, like in the oil chain. It's like you've got the oil well and the convenience. We're the convenience store where people show up, right? So we're at the end of the value chain. It's like I need to go upstream. I need to have relationships with people at all levels of the value chain, not just inside the hospital. I need to have relationships throughout all. So when we do come into an issue of some sort, because there's always going to be one. There's always going to be, there'll be a COVID, or there'll be what if a unfortunate natural disaster happens, or not even that major, just there could be any number of circumstances that happen that you need people's support, and you have to be aligned with them, and you have to have a trusted relationship with them to know that when you do reach out, you're not reaching out you don't just have your hand out, but you're actually a true partner of theirs. And I think that's what's important. And so the life of a hospital CEO or hospital administrator it's 24/7, right? And it's a beautiful thing, but it's also it's very difficult because you have to be able to manage all those pieces inside the hospital, the actual workings of the operations, and then you got to be able to step out and say, how do we translate this so it makes sense to people that can help us in the future when issues come up, or because we're serving their population, we're serving their voters, right? So you have to have that. You got to be able to translate what you're doing to them, et cetera, and build those trusted relationships. So I don't know
Just
if that
just
was.
because of more from a natural curiosity standpoint, it sounds like what you're mentioning is you're dealing with a lot of stuff that's coming at you day in and day out. It's just a natural cause. When you have to make difficult decisions, take us into your mind. How do you kind of process, make difficult decisions? What do you like? What's that like to get ultimately an ideal outcome for a decision? Can you share a story on something where you had to make a really difficult decision and take us through that process? Like make it concrete so people kind of know and can feel what kind of pressure you're talking about here.
Um, geez, I mean, there's any number of these. Um, so let me. There's any number of actual concrete examples, but I think the real important part of the question is, where do you start in your mind, right, as a
Yeah.
leader? And I think if you don't start with truly having empathy and care for patients and their families, if you don't start with that first and foremost, everything is just a business decision. And unless you have the patient and the family at the heart of it all, this is just me. I always try to start there, even with all the financial pressure, because you could have situations where patients don't have funds. They show up in the ED, and it'd be probably easier to try and move them out of the system somehow, right? Move them to another system, transfer them out. But sometimes, the right thing to do is to care for them. They're in your community, right? It's the right thing to do. And there's a cost where you're not going to get paid, right? It's bad debt, and it ends up becoming our charity care. And that has a significant negative impact on the bottom line. And so unless you start with the patient family first and foremost in your mind, I think everything else kind of rolls from there. Otherwise, it's just a financial decision. And if it's only a financial decision, I think you can make really bad decisions and things that aren't really good for once again, the patient and the family. And that's not the mission of being in a hospital or health system. in my opinion.
So let's because I know we're kind of close to time here. How do people follow the work that you're doing? How can they best get a glimpse as to some of this innovative work that you and your team have been up to? Share with us. Give us a little bit more of a commercial if you can.
Well, so Sellers Dorsey, they're a national firm, they're a wonderful firm, with a great leader, Marty Sellers. And so, you can look on the website. You can look me up on LinkedIn if you want to. Joseph Rafferty. I'm on LinkedIn, very active on LinkedIn. And what I would say is not even so much engaging myself or Sellers Dorsey, or any other organization. I think it's just about folks becoming more aware of their community, their population. If they can do anything, figure out a way to serve your community in a positive way, right? Don't need to follow me. I don't care. It doesn't matter to me. What's most important to me is really, what steps are you taking to help serve your community wherever you are. And that could just be doing simple things. And that's what has the most impact at the end of the day. So probably wasn't a good answer for you, but
So if there is one take, any executive leader that's listening to this, that's running and operating a hospital, health system, in that event, is there an ask?
no, just more being grateful. I mean, thanks
Yeah.
for serving what you do, and continue to. I guess the only answer, continue to be just true to your mission, serving the community the right way. That's the whole reason why hospitals and health systems and this system exists. And
Yeah.
so, keep doing the good work. I mean, it's great. I mean, it's hard work.
Yeah.
It's not all fancy suits and good dinners. I mean, a
Yeah.
lot of it is hard decisions, and most of the conversations that you're in on a day-to-day basis are, they're not favorable because the headwinds are that strong for most hospital CEOs. And so, you have to be resilient, and I appreciate all the work that they do. It's impressive.
Joe, thanks for coming on today. It's really awesome. It's great to get a glimpse from an insider's viewpoint, always just being rigorously honest, sharing with the community. And for those that you've been listening and you found this conversation to be helpful, enlightening, please comment, share, engage with it, like it. That's what allows it to get into more people's hands, because this is extremely valuable. I learn something every single time I get a chance to sit down with some extraordinary leaders. So Joe, appreciate you. And you're obviously always welcome to come back on and share more
All right,
stuff. So
Michael,
stay
thank you.
safe.
Appreciate you, man. Really appreciate
You
you.
got it.
Take care, bud.